Well, this week, Obama announced that Americans with insurance plans that were canceled since the implementation of Obamacare can opt for catastrophic coverage in 2014. Well, that's sending the insurance industry scrambling because there's only a few days left before 2014. But at the White House Health Summit, which was back in February of 2010, the president laughed off some suggestions by Wyoming Senator John Barrasso. He suggested that catastrophic insurance was viable. I spoke to the senator earlier and asked him if he feels vindicated by the president's change of heart.
Well, you know, he came out with this late night kind of announcement to try to hide it from the press that once again he is changing the health care law. I think that catastrophic coverage is the right approach for a number of people. It's helpful. The president said it was awful, but now he is admitting that due to the hardships that have been presented because of the health care law, that now it's okay to have catastrophic care. You know, it's the kind of thing that actually helps people avoid bankruptcy, helps people avoid the loss of their house or kids having to quit school because of some terrible health emergency. So, you know, what the president was arguing and disagreeing with Republican ideas 4 years ago, it just seems that in the last week now, he's embraced them.
And even a few weeks ago, he was calling this type of policy junk insurance, wasn't adequate, didn't fully take care of people's needs. You know, it's hard to understand what Obamacare is going to be because it changes every week depending on the political circumstances the president finds himself in. Does that give Republicans a little bit more ammunition going into 2014 to push for serious changes in the structure of Obamacare?
Well, you know, as a doctor, I want to make sure that people can find quality, affordable health care from a doctor that they choose. And I think the president's plan and law just actually makes it worse. The president in his press conference this week seemed to think that everything was going fine except for the website. But you know, Governor, the website is just the tip of the iceberg. People are seeing that they've had their policies canceled, premiums are going up, higher deductibles, higher copays. You can't necessarily keep your doctor even if you'd like to, and then all the issues of computer fraud and identity theft.
Well, one of the problems, the president keeps changing the rules as to when implementation is going to happen. The latest is he's pushed off on the insurance companies that people can enroll as late as the 31st, but the insurance companies have to be able to enroll them within a matter of hours, not days or weeks, which normally it would take. You and Senator Mike Enzi, your colleague from Wyoming, and Lamar Alexander of Tennessee have introduced some legislation that would force the administration to actually follow their own law. Tell us about what it would do and why it is important to make sure they live within what they said they wanted.
Yes, well, this is consequential legislation. It's called the Premium Disclosure Act because the president now wants people to not know what their insurance is going to cost in 2015, Mike, until after the elections. He has unilaterally said, well, rather than the October 15th date when people would sign up and know what things are going to cost them next year, he's pushed it back instead of from 2 weeks before the election to 2 weeks after the election. And with our legislation, we say, not good enough, Mr. President. October 15th is the date, and people need to know by September 15th what their premiums are going to be the following year so they can make plans, they can budget, they know what the costs are going to be. You know, the president continues to try to mislead the American people, and this legislation tries to prevent that.
67% of Americans say the whole thing should be delayed, but if there's another delay that is just sort of arbitrary, doesn't that make it even more difficult for insurance companies to implement the plan? They don't know how many customers they're going to have and how to spread the cost, and that would seem to me as catastrophic as the catastrophic nature of the website if this were to happen.
And it is what's happening. I think that we're seeing as the people that are going to the website 60 or 70 times to sign up are clearly the sicker people who need want insurance immediately. That leads to what to me is an insurance death spiral with only the sick folks sign up. So then the cost is going to go higher and higher. And I think that the president is going to then try to unilaterally bail out the insurance companies by with the taxpayers paying for it. But I'm calling to actually remove the entire individual mandate. The president unilaterally did it with the employer mandate, delayed that for a year. It is the individual mandate is the most unpopular part of the law that the government says, hey, you have to buy a product, and it's a government-approved product that for many people is a product of insurance that they don't need, they don't want, they'll never use, they can't afford. And you talked about these junk policies, at least the way that the president described them. So we have a rancher in Newcastle, Wyoming, and she got a cancellation notice, Governor, because she didn't have maternity coverage. Well, she's already had a hysterectomy. She's not going to have any more babies, but her policy was good enough for her and her family, but it wasn't good enough for the President of the United States, so it was canceled, and you know that's wrong.
Well, Senator, I appreciate it very much. And by the way, I'm delighted to know that I, too, will have maternity coverage. Just in case some medical miracle should take place, I am fully covered for delivering a baby. I don't think it's going to happen. I really appreciate it. Merry Christmas to you and your family. Thanks so much for joining us today.
Merry Christmas to you. Thank you, Governor.